Did you know that menopause doesn't cause cancer, but age-related cancer risks go up during and after menopause? Hi, my name is Anita Kaiser, and this is episode 6 of the podcast series Menopause and SCI in a Hot Flash, where we'll talk about breast and ovarian cancer as they relate to menopause. Joining me is my colleague Margaret Conquest and our guest, Dr. Jessica Armelon. She's a physician at Toronto Rehab's Lyndhurst Centre, University Health Network, and lecturer in the Department of Family and Community Medicine, Temerity Faculty of Medicine, University of Toronto. Welcome to the show, Dr. Armelon.
Thanks so much for having me.
So cancer is a word that hits home for many of us. Chances are you know someone like a friend, family member, maybe even yourself, who's faced this tough journey. It's emotional and it's often filled with uncertainty, but knowledge is power. And while it doesn't erase the fear, it can give us more strength and understanding. So I want to start by asking you, Dr. Armelon, what are the most common cancers in women?
You're absolutely right. Cancer is a diagnosis that touches so many lives. And through this podcast, my hope is that listeners will leave here with a clearer understanding of certain cancers, how common they are, and what steps we can take towards prevention, early detection, and support. When we look specifically at women, breast cancer is by far the most common. According to the Canadian Cancer Society in 2024, breast cancers accounted for about 25% of all new cancers in women and 13% of all cancer deaths. Those numbers really underscore its impact, not only on the individual diagnosed, but on families, communities, and the healthcare system. After breast cancer, the next most common cancers in women are colorectal cancer and lung cancer. Of course, these cancers are not unique to women. And we cannot overlook the gynecologic cancers. Those are the cancers that start in a woman's reproductive organs. Because while they may not be as common as breast, colorectal, or lung cancer, they can be just as serious. These are most commonly ovarian cancer, cervical cancer, and uterine or endometrial cancer. By talking openly about these cancers, we can help break down some of the stigma, encourage screening, and empower women to seek medical advice when something doesn't feel quite right.
Thank you. So when it comes to breast cancer, what assessments should be done to screen for it?
Yeah, I found that breast screening for me was really challenging because I have small breasts and I was expected to sit up straight against a machine on an office chair with wheels when I had no trunk support. And I had to fit myself inside this machine and hold still while they took a scan. And any small shift and I popped out of the machine. So I honestly think they only scanned my nipples. And really, when you think about it, it's almost laughable, but there's got to be a better way. So I'm curious to hear what those assessments are.
I hear you, Anita. And breast cancer screening can be a real challenge. In Canada, the main screening tool is the mammogram, which is essentially like an X-ray of the breast. For women at an average risk, most provincial guidelines recommend having a mammogram every 2 years, starting at age 40. For women at higher risk, screening may start earlier and happen more frequently. This could include things like annual mammograms, breast ultrasounds, breast MRI, or a combination thereof. It's also important to be breast aware, which essentially means knowing what's normal for you. So if you notice changes like a lump or skin dimpling or nipple discharge or persistent pain, you should definitely bring that to your healthcare provider, and then they can do their assessment and decide what's best for you. When it comes to breast cancer, screening is all about finding the disease early before the symptoms appear, if we can, because early detection often means more treatment options and better outcomes. Also remember that screening isn't perfect, but it is a really powerful tool in reducing the impact of breast cancer, especially when combined with awareness and timely follow-up.
Well, what you've described there is pretty much me with having dense breast tissues all my life. And so I've been getting breast exams and mammograms for a long time, and more recently, the addition of ultrasounds. It's actually been relatively positive. I do recall, though, early on, just the difficulty of getting into position, staying in position, and sometimes the technician's not really having a good understanding of how to support me and what to expect from me. But they've come along for me, anyways, in my experience, quite a long way. And I haven't found them to be terribly painful, even though I have pretty good sensation. And they've been pretty good about helping out with transfers or leg management. Certainly, you do got to advocate. You do have to tell them what you need. And yeah, getting a mammogram is never a happy event other than it's what you do to get an early diagnosis if you are in that category of person that's at risk.
Going off that, if we want to be proactive and take charge of our health, what type of symptoms should women be looking for specifically? And how does SCI make detection more difficult?
Being proactive about your health starts with knowing your body and recognizing when something you're experiencing is different or unusual. For breast cancer, some of the symptoms to watch for could include a lump or thickening in the breast or underarm tissue, changes in the size, shape, or appearance of the breast, skin changes like dimpling or puckering, nipple changes like nipple inversion, unexpected rashes, or discharge. Persistent pain in one area of the breast is another example. Now, when we think about women with spinal cord injury, detection can be more challenging for a couple of different reasons. The first thing to think about can be that there may be reduced or absent sensation in parts of the chest or underarm area, meaning that lumps or discomfort may not be detected. And also, if hand function is impaired, this can make self-breast exam more difficult. Looking in the mirror for changes in appearance to the breast, symmetry, or skin can be very important here. Additional things to think about are changes in mobility that can make it harder to perform self-checks or attend screening appointments, especially if specialized equipment or positioning is required for a mammogram, exactly like you mentioned, Margaret. So for women with spinal cord injuries, going to your healthcare provider for regular clinical breast exams, going to accessible imaging facilities, and sometimes more individualized screening plans are so important. Partnering with your healthcare provider who really understands your own unique needs can be really helpful to ensure that early detection isn't missed.
Okay, so what are risk factors of breast cancer that we need to be paying attention to, and what can women do to decrease their breast cancer diagnosis risk?
Breast cancer usually develops for a mix of different factors, and it's usually a combination of some things we can't change and other things that we can influence through our lifestyle and those types of choices. Factors that we can't change are things like our age. Unfortunately, every day you're a day older and every day risk goes up. Family history, especially if close relatives have had breast or ovarian cancer. Genetic changes like mutations to the BRCA1 or BRCA2 genes that some may have heard of. Reproductive history like the age at your first period, the age at menopause or pregnancies. And dense breast tissue like we've talked a little bit about, which can not only increase your risk, but also makes mammograms a little bit more difficult to interpret. And knowing these risk factors can help guide how closely you might need to be monitored. On the other hand, are those factors that we can influence. These are largely lifestyle related and would include things like limiting alcohol, making sure you're staying physically active, maintaining a healthy weight, avoiding smoking and secondhand smoke. All of these can lower the risk. These habits also, as a bonus, help to improve your overall health. Hormone therapy, particularly combined estrogen-progesterone therapy for menopause symptoms, can slightly increase the risk of breast cancer. That doesn't mean automatically that it's unsafe, and many women benefit from it. But it is important to know about because I would encourage you to have a conversation with your doctor about the potential risks and the potential benefits, and if there are any alternatives for this, if it's something that's right for you. Basically, at the end of the day, combining your healthy lifestyle habits with regular screening will give you the best chance of catching breast cancer early or preventing it from developing. Even if you do everything quote unquote right, there are no guarantees. The idea is to try and tip the balance in your favor and do the best that you can.
So let's shift our focus now and talk about the other big cancer you mentioned for women. What kinds of assessments should be considered to help detect ovarian cancer early?
Ovarian cancer is a little bit trickier because there's no single reliable screening test for women at average risk. And the symptoms can be kind of vague or mistaken for other conditions. That's why early detection often relies on a mix of awareness and targeted assessment for those at higher risk. For women with a strong family history or known genetic changes, like we've mentioned the BRCA1 or BRCA2, the doctors may recommend things like a transvaginal ultrasound to look for changes in the ovaries, a blood test called a CA-125, which tests a protein in the blood that may be elevated in ovarian cancer, though it's not so specific and it can be elevated for other reasons, just something to be aware of. In some cases, genetic counseling and genetic testing can help to clarify risk and guide some prevention strategies. For most women, the focus is on being aware of the symptoms that persist or get worse over time, like bloating, pelvic abdominal pain, feeling full quickly, changes in urinary habits. Definitely bring these symptoms to the attention of your healthcare provider if they occur. And while we don't have the perfect screening tool for ovarian cancer, combining risk assessment, symptom awareness, and being really proactive, like we've been saying all the way through, is the best chance for catching it early.
That's me again. For years, I've taken all the recommended routine screening pretty seriously, and I try to book them around my birthday every year as a gift to myself. When my periods did start to change in perimenopause, I started tracking them and made sure to mention changes to my family physician. And when they really started to ramp up and become problematic, we started doing a bunch of different screenings, including ultrasounds of my ovaries. And we did see some cysts. We wondered if those were problematic. And so we did some repeat ultrasounds for a while until the results just came back showing normal, rise and decrease in the size and nature of the cysts as they do usually with your periods. But with all that and other screenings, we did find other things that were abnormal. And what I can really say to anybody and everybody is that screening works. And that's how you find things before they become really big and problematic. So then from there, what are the risk factors for ovarian cancer?
You're absolutely right. Screening can be very effective. And sometimes, as you mentioned, when a woman has an ultrasound for another reason, we can spot these incidental findings in the ovaries. And many of them turn out to be benign, like a cyst, but occasionally they can actually lead to early detection of ovarian cancer. The challenge is that ultrasounds can't always distinguish between the harmless and the concerning changes. So sometimes that follow-up testing is necessary, like you mentioned, until you can sort of see the resolution. When we talk about risk factors for ovarian cancer, it's similar to breast cancer in that some factors we can't change and others may be modifiable. The risk factors that we can't change, again, we have age. We know that most ovarian cancers occur after menopause. Family history, especially ovarian, breast, or colorectal cancer in close relatives, those genetic changes we've mentioned, conditions like endometriosis, and we also look at reproductive history. For example, having never been pregnant would be a risk factor. When we look at possible modifiable risk factors, those would be things like hormone therapy, because long-term use of estrogen-only therapy after menopause can cause an increased risk. We also look at obesity, especially a body mass index of 40 or greater, smoking, particularly linked to a type of ovarian cancer called mucinous ovarian cancer, and also having a high dietary fat intake can increase the risk. On the flip side, there are protective factors, like taking birth control pill, having been pregnant, and breastfeeding can lower the risk by reducing the number of times a woman ovulates over the course of her lifetime. This has been associated with a decreased risk in ovarian cancer. While we can't eliminate all the risks, understanding your own personal and family history can help your doctor decide if extra monitoring is needed, if we need genetic testing, or other preventative strategies.
So it's nice to know about these modifiable factors, but I still feel like this type of cancer is really tricky for those of us women with spinal cord injuries to be able to identify until it's in the advanced stages. So what type of symptoms should women be looking for, and how does having a spinal cord injury make detection more difficult?
You're right. Ovarian cancer can be very tricky to detect early because many of the symptoms are almost like invisible or easily mistaken for everyday issues. So that's why awareness is so important here. Basically, what you want to do is look for persistent changes. Things like bloating or abdominal swelling, pelvic or lower abdominal type pain, feeling full quickly, or having changes to urinary urgency or frequency, as well as changes to digestion or bowel habits. Less common symptoms can include things like nausea, fatigue, unexplained weight loss, bleeding after menopause, menstrual irregularities, back pain, indigestion, pain with intercourse, or even bleeding after intercourse. The key is that they are persistent. Symptoms that last for weeks or gradually get worse should absolutely be investigated. For women with spinal cord injury, detection might be even harder. Reduced sensation may mean that discomfort or bloating would be unnoticed, and if bowel or bladder function is affected, typical warning signs might not be felt. Mobility limitations can also make self-exam or clinical exams a bit more challenging, and sometimes specialized imaging is needed. As we've said throughout this whole process, it's really important to be self-aware and to have those regular check-ins with your healthcare provider who knows your own unique needs. This is so important. I can't underscore this enough. Tracking changes, reporting symptoms early, and accessing sometimes adaptive screening if necessary can really make a big difference in ovarian screening.
You mentioned that the symptoms of ovarian cancer are invisible, which is different from other cancers. Are there other ways that it might be different?
Ovarian cancer is different from many other types of cancers because the symptoms, as you said, are often subtle, invisible, or sometimes really hard to detect, especially in those early stages. One reason it's tricky is that the symptoms can closely mimic normal menopausal changes. Some examples of this are symptoms of bloating, abdominal discomfort, or changes in digestion that a person could feel that would be typical digestive issues or weight fluctuations that you might expect during menopause. And this is actually also a symptom that's quite common in those with spinal cord injuries. You could also experience fatigue or low energy, which can be attributed to hormonal changes, stress, or sleep disturbance. Changes to urinary habits or pelvic pressure might be mistaken for natural changes in bladder function. Even irregular bleeding or spotting can be confused with perimenopausal period changes. In patients with spinal cord injuries, these can sometimes be difficult to determine if the source is rectal or hemorrhoidal bleeding as well. This can sometimes take a little bit of some additional investigations or examination to determine the exact source of the bleeding. Because these symptoms are so similar to what many women may experience during menopause, it's easy to overlook them or assume they're just menopause. But that's why the focus is on those persistent or unusual or worsening changes rather than occasional or mild symptoms. When symptoms are present or a lump is found on exam, a doctor may perform tests like a pelvic exam, transvaginal ultrasound, or that CA-125 blood test that we mentioned, which measures that protein that can be elevated in ovarian cancer. Even though there's no reliable screening test for all women, being aware of these subtle changes and reporting them to your healthcare provider can really make a big difference in early detection of ovarian cancer.
So to end things off, what would be your take-home message that you want people living with a spinal cord injury who are experiencing perimenopause and menopause to remember about cancer?
Regular screenings with your healthcare provider will help with early detection.
Thank you, Dr. Armelon. If you found today's talk interesting, check out our action planning tool on the website at www.scifragments.ca, and feel free to send us your feedback using the survey provided on the website. In the next episode, we'll talk about mood, cognition, and sleep disorders as they relate to menopause.